Hi, I'd like to discuss what I call the 5 keys to maximizing your success after weight loss surgery. There are 5 things that are required no matter who you are and no matter what surgery you've had. I'll mention them briefly and then I'll describe them in slightly more detail. The first one is the anatomy has to be correct. The second one is you have to have a diet that works for you and maintains your weight. The third one is you have to have healthy nutrition. The fourth one is you have to have a regular exercise system, regular exercise program that you follow. And the fifth one is you need periodic follow ups by somebody who understands bariatric surgery. Okay, so the first one is anatomy. That seems like a no brainer, but a lot of people don't realize that. And a lot of programs don't follow that principle. The only thing we do as surgeons in the operating room is we change anatomy. We alter your anatomy in order to achieve a result. An orthopedic surgeon puts in a device, a total knee, or something to correct a bone fracture or something like that, and it has to be done correctly or it doesn't work. A heart bypass has to be done correctly or it doesn't work. Cancer surgery needs to remove all the cancer that you can possibly remove or it doesn't work. And weight loss surgery is the same way. There's certain principles with each operation, the lap band, the gastric bypass, the gastric sleeve, whatever, that need to be done correctly. Otherwise, you're kind of doomed from the start. The surgery will never work correctly. So the first one, anatomy, if the surgery is done poorly or incorrectly at the beginning, you will not lose enough weight early on. That's really the indicator. People will say, well, I had the surgery and I had to eat slower. I adapted to it. And I got used to eating slower and the surgery worked great. And at 3 months, I was losing weight and everything was wonderful. Okay, so there the surgery was done correctly. Other people will say early on, it just didn't seem to work. I didn't seem to have to eat slowly. I could eat fast. I could eat a lot more than I thought I could. Well, that's an indication that most likely, not in every case, but most likely the surgery was done incorrectly. Most surgeries are done correctly. That's the good news. Okay. So with that system, you have the weight loss early on, but then over time, you might notice, something, I can eat a lot more, I can eat a lot easier, and I'm gaining weight. Okay, well, then this anatomy has changed. But in either instance, if the patient says, I'm having these issues, and they describe it to a weight loss surgeon, the surgeon should check the anatomy. The first thing shouldn't be, oh, you need to follow the diet. There is no sleeve diet. There is no gastric bypass diet. And I talk about that in other videos. I put it in my book. A sleeve diet or a band diet is just a stupid thing. There is none. The surgeons say uh, diets don't work. And then a lot of programs say you had the surgery, now you got to follow a diet. Well, what makes the diet work afterwards? The fact is the surgery has to work and then you work with it. So if the surgery isn't working or it doesn't seem to be working, the first thing to do is check the anatomy and make sure it's correct, whether it changed over time or whether it never worked in the first place. The surgery can usually be corrected if there's something wrong. Okay, the second thing, first one's anatomy. Second thing is you have to have a diet that works for you. Okay, what I mean by that is with the surgery, you modify how you eat and you come up with a new eating pattern that allows you to maintain the weight you want and still be satisfied. I have a program at my clinic and I called it the Dietary Rebuild. I wrote a book about it right here. It's in my weight loss surgery book. It's in my medical weight loss book, High Impact Weight Loss. The Dietary Rebuild is a system for identifying an eating pattern or a set of eating habits that work for you and allow you to keep the weight off forever. So that's the second key, that you have a healthy diet that works for you. The third one is adequate nutrition. Now, eating a healthy diet doesn't necessarily guarantee adequate nutrition. A lot of people will come in, they'll find out they have low iron. They have low vitamin D, extremely common, low B12, low thiamine, um, maybe the calcium's off, something. So what I tell all the patients are you need at least one high quality multivitamin just to make sure you're covering the bases. And then some people need additional ones. They might need additional iron or additional B12 or something like that. Okay. If you check all the labs correctly, you'll find out what you need. But to cover the bases early on and in general, just have a multivitamin that's high quality, not some garbage you bought at a discount store, because they generally don't have much in them. Okay. A good multivitamin has quite a bit in it. And that's what I'm talking about. So, one, correct anatomy. Two, a diet that works for you. Three, healthy nutrition. Four, you need to exercise. Okay. People need to realize that when I had the weight loss surgery, a major reason for having the weight loss surgery is so I could do more in life. Well, doing more in life doesn't just require weight loss, it requires you to start practicing doing more, which is exercise. I call it expanding your range of capability. And that's a topic of a podcast that I've done. So, expanding your range of capability is fundamentally getting more physically capable, and that requires exercise. And the thing about exercise is, although it doesn't necessarily help you lose a lot of weight, it definitely, and it's been shown in many scientific studies, prevents weight gain. So once you lose weight, if you don't want to regain it, having a baseline exercise that keeps your muscles toned and helps your metabolism is a mandatory thing to do. The last thing is that you need to have follow up periodically with a weight loss surgery expert. Now, that might not be a surgeon, it might be an internist that understands weight loss surgery, but most doctors that don't do bariatrics or bariatric surgery don't understand it. They couldn't even draw out a diagram of the procedure you had. So, if they can't do that, how do they understand how to detect if something's going wrong with that procedure, if everything's okay, and if everything's, uh, fine, and then they can just keep following you up. But what they oftentimes do is somebody will go in and say, I can eat a lot more. And they go, well, everybody fails. And then somebody else comes in and says, I seem to be getting too skinny. Well, the surgery really makes people too skinny. Well, which is it? Everybody fails or you get too skinny? It's neither. And so I hear this stuff all the time. And, everybody doesn't get pain. You don't all get dumping. Very few people get any significant dumping. It's just a fact. And, all these other things that are attributed to weight loss surgery are oftentimes just baloney. So what you want to do is you want to follow up with somebody who knows what they're talking about. And if you do that periodically, it will help you maintain your weight, which is the purpose of the whole thing in the first place. Okay, so the keys are anatomy, correct anatomy. 2, you have a diet that works for you. 3, you have healthy nutrition. 4, you have an exercise program. And 5, you follow up with a weight loss surgery expert, probably at least every other year. All right. I hope this helps you. And I think that these things are important. And I hope you've listened to this and you've gotten something out of it. All right. Have a great day.